InnoHSupport. Hello and welcome to our InnoHSupport webinar, where we will move around the topic of overcoming cultural barriers to public procurement of innovation in healthcare. I'm Elisa Frenz, CEO of Health Europe, project partner at the EU project InnoHSupport, and your moderator of today's session. Today, we are focusing on a critical, but I would say often under-discussed issue, namely cultural barriers. How mindset, organizational habits, and risk aversion affect our ability to bring innovation into healthcare through procurement. So what are cultural barriers and what are we talking about if we talk about these? So looking into risk-averse attitudes in public procurement, thinking about a bias toward the known over the new, or seeing procurement rather an administrative process than a strategic lever. And from my experience, I can draw a lot of knowledge in regards to that disconnect that happens between clinical needs, innovative solutions, and the procurement processes required to procure innovation. So just addressing a couple of them, and we will dive deeper in just a moment, we're not looking into technical gaps, but actually behavioral and institutional ones. So solving these is not about better policies, but it's about changing the way we think and we collaborate. So why is this topic of urgency? Just want to share a couple of facts that actually underscore the challenge. Think about public procurement accounting for approximately 14% of GDP in the EU, and healthcare making up a significant portion of that, especially hospital systems. Despite that fact, only 1 to 2% of all public procurement in the EU are currently classified as innovation procurement, meaning purchases that actively aim to drive innovation. The top one reason public buyers avoid using innovative procurement procedures is the fear of legal challenges or audit consequences. And despite these three figures that I just shared with you, 90% of European healthcare organizations report a strong need for innovation to address demographic and digital transformation challenges. So I think it's obvious that the question is, how do we get innovation embedded into healthcare systems, and how do we make that happen more often? In order to get started with our session here today, I'm very happy to have three fantastic speakers with me that share their findings, their insights, and their experiences. And therefore, I'm absolutely happy to welcome Carolina Bellotti, Assistant Professor in Healthcare Procurement at the University of Twente, Maria Sanchez Amat, Senior Manager for Open Innovation and Innovative Procurement at EIT Health, and Sofia Moreno Perez, Director at Valde Innova and Partner at HIPS. So our session today isn't about showing polished success stories. It's about sharing the real world complexity of trying to do something different and how we're overcoming it together. So with the overview of our agenda of what we're up to within the next 60 minutes, we will have on the next slide the outline of the different topics, with Carolina starting to spotlight the topic from a system level and highlight the cultural barriers identified within the InnoHSupport project. We have Maria Sanchez continue with her reflection on the untapped potential of public procurement and how to build the bridge with innovative market players. And we have Sofia Moreno Perez that will discover with us the cultural realities and related hurdles when it comes to PPI. We will close this insights from our speakers with a dedicated Q&As. So we will dive deeper, and I'm already quite happy to explore with them individually of what we can do to innovate better. Before we start, I would like to share with you a brief insights into the InnoHSupport and our project's purpose. That means on the next slide, how we have been building a program that does support hospitals and healthcare facilities in making innovation procurement a reality. And we have defined 3 pillars within InnoHSupport that is looking into capacity building, namely to drive the upskilling through training and executive education, looking into hands-on support for healthcare institutions through advisory service as our pillar number 2. And I would say a very important and embracing pillar is the aspect around collaboration and matchmaking. So how do we facilitate the connections? We have brought together a very diverse consortium that is spanning across Spain, Ireland, the UK, the Netherlands, and Tech2 being represented here into these different regions. And we will continue with our main objectives of what we're looking into achieving within the InnoHSupport project on the next slide. Namely, for us, as I already mentioned before, creating a network, a community is key to driving change, and particularly bringing together public and private actors, because this is for us the key to facilitate procurement and innovation. And to make it as easy as possible and drive the community, we have been establishing a central hub for collaboration, our Innovation Procurement Agora. So this is where you can find anything related to the project and more to help create the connections that currently are still in silo. Moreover, because the upscaling is required in order to drive innovation within healthcare systems through procurement, we are dedicating a huge amount on capacity building programs. And last but not least, sustainability. I think we have been hearing that a lot. And we also put that as an important context within our program to ensure that strategies for procurement consider environmental goals. How to engage with us. So as I've mentioned, there is 3 different pillars, and looking into the capacity building, that is a good time for you right now to come on board, to apply for the masterclass or train the facilitator. So you still have time to submit your applications by early August. So take the time to look into how to apply and submit your application for us to assess and have you benefit from the trainings that we have been built together with the consortium partners. On the other hand, the second pillar on the advisory services, we are moving on dynamically, and we are very keen to receive the demands from the healthcare facilities of what it is, what you're challenged with when it comes to embedding innovation procurement into your daily activities. So this also goes out to you. And even though you see here in tranche 2 that the deadline is passed, we really want to make sure that we overcome this summer period and also motivate you to submit your applications. The matchmaking is our activity to bring suppliers and providers, or the demand and the response together within our different calls that we have ongoing. And for here, we are requesting innovative suppliers to also share their applications with us within the second cohort between June and September 2025, and the third cohort starting early in 2026 between January and March. And then we have the sessions continuing along the way in 2026. So that brings me to Carolina, our first speaker, who will unfold the cultural barriers in PPI. And Carolina, I'll hand over to you for your presentation.
Thank you very much, Elisa. I'm gonna share my screen. I hope you can see my presentation in full mode. Yes, okay, thank you very much. So I'm Carolina Bellotti. I'm assistant professor at the University of Twente in healthcare procurement. So among my research strings, I'm focused on value-based procurement, which is very closely related to this topic that we're talking about right now. So how healthcare organizations can actually have long-term savings and bring more innovative products as well. And another research stream that I've been focused on the few past months is PPI, Public Procurement of Innovation. So how dynamic capabilities can help healthcare organizations to deploy more innovative procurement processes. So that's a bit about myself. And I'm gonna talk about the cultural barriers now that impede this public procurement of innovation to be deployed in healthcare institutions. So first, we need to know that in the healthcare sector, innovations are a little bit different than what they occur in other industries, for example, because the healthcare sector is highly dependent on the innovations that come from the suppliers. So generally, the suppliers are the ones developing innovation. And on the other hand, the healthcare sector also needs a lot of innovation to tackle the current needs and also future needs. For example, we have changes on the demographics in the near future. So we have aging of population. So these innovations, they can actually help to overcome these problems. We also have the rising costs of the healthcare systems in the whole world. So innovations are available for that. And PPI, Public Procurement of Innovation, is a strong tool or instrument to make these innovations happen in the healthcare sector. But even though considering all that, the healthcare sector is still lagging behind other sectors. Innovations are very slowly deployed in the healthcare institutions because it presents many challenges that are specific to the dynamics that occur in that scenario. And we're going to see that these cultural barriers, they are related to some of the dynamics that occur in the healthcare institutions, as I mentioned. And one of the main challenges is that these cultural barriers, they are very diverse. You cannot just simplify and attribute these cultural barriers to one or other elements, but they occur in many different layers, and they are also originated from different sources, and they interact between each other. So that's why it's very challenging to overcome these barriers. So as a partner in InnoHSupport project, I mapped the main cultural barriers for public procurement of innovation in the healthcare sector. So in some, what I did was to look for literature, academic literature on the public procurement of innovation and which barriers were occurring then, which ones were cultural. Also look at government reports, for example, and I summarized the main insights. As you can see here, those are the main cultural barriers for public procurement of innovation in the healthcare sector. And they range from, for example, the legal framework, which is more policy related, to, for example, risk aversion, to the relationship with the suppliers. So just highlighting what I have mentioned on the past slides, these barriers, they are coming from different sources, and they also interact between each other. But next, we're gonna dive into each of those cultural barriers, explain a bit each of them. So we know that the public sector and also the healthcare sector, they are very risk avert. So if they don't know something new in innovation, what the result's gonna be, they are very careful with that. Also because they cannot risk, because they're talking about lives, they're talking about patients. This risk aversion is very present in the healthcare sector. And not only at an organizational level, but also at the individual level. So how these people that are buying these products and services perceive these risks can also become an important barrier. And then you need a bigger cultural shift to tackle this risk aversion on the individual level. The mindset of how these products and services are bought in the healthcare sector is also a big challenge because first, normally these items are bought in bulks, so in high volume. So the more you buy, the more discount you can get. So that can be applied to some commodities. That's a very smart technique of buying. But for more innovative products, maybe that's not the best option because you need to be closer with the supplier. You need to talk about how they can provide more innovative solutions. So that's one of the problems that you see here. The traditional mindset is also based on cost containment. So you look at the unit of the price of the product. So the lower it is, the better. And there's a lack of this value-based procurement approach, because if you're just looking right now at the short term and not seeing what are the long-term benefits that you're going to get, even though you can spend a little bit more now in a certain product. So that's also something that should be developed. Some public buyers also don't know how to find or to approach innovative suppliers. They don't know who they are, how they look like, how to talk with them. Also the public procurement innovation process. So yeah, some public buyers, they don't really know how the process is implemented in practice. So they also don't know what are the current needs of the market. So what do we need now in terms of innovation? What in the future needs to be developed? That's also something that is under this lack of knowledge type of cultural barrier. In the healthcare sector, we also have some very specific cultural barriers that are closely linked to the dynamics that occurs in this sector, such as the stakeholders dynamic. If you think about the public buyers, they are buying products and services for the physicians to use. So the physicians, they are the people that are actually using these products on the first stage. And these physicians, they are buying these products on the behalf of the hospitals and also on the behalf of the patients, because the patients will be benefited by this purchase of these products or these services. So it's a very complex dynamics that occurs here, because in some cases you can have some strong preferences physicians have, and the priorities are not really aligned between these different departments, which can jeopardize innovation. So that's also an area that needs to be further developed. So it needs further alignment between all these different functions, these different departments in hospitals. The way the hospital itself is also organized regarding its structure can also pose some cultural barriers, such as if the hierarchy is very rigid, there's no flexibility, there's very little room to innovate and to propose new solutions. The way also that the procurement process is organized can also be a big barrier, for example. So if they focus too much on price rather than on quality, that's very difficult to search new opportunities to promote innovation, to give new ideas. So it should be more flexible. And the lack of leadership can also be a big barrier. So you do need a sponsor, any type of changes that are doing in a process at the organizational level. You need to have a champion or a sponsor, someone that has leadership and tells, okay, that's important, let's look at it. Another type of cultural barrier is the way the relationship with the suppliers is developed. Because if the public buyer is looking just for operational issues or negotiating prices, and not talking about, okay, can you get innovations? Can you propose some new ideas or new solutions? That's also a big barrier. Talking a bit more about policy level. So we have some rigid regulations for public procurement of innovation. So it needs more flexibility. So some suppliers might feel discouraged to participate in the tenders, for example. The public buyers also may not having willingness to buy innovations, because also this cost-based mindset, for example, or they don't know which innovations are important for the current needs and the future needs. The way the budget is structured can also be a barrier, because you have this fixed budget for the year, and innovations, some of them can be a bit more expensive, and the way the budget is distributed among these different departments can also be a barrier. The tendering process can also be complex, especially if you have very prescriptive specifications. So when you talk about specifications, it's the way you ask suppliers to provide the products and services and solutions. So we have technical specifications and functional specifications. So on the technical specifications, you're telling them everything that you want, what are the features and the characteristics of the products. So they should use more functional specifications, leaving the supplier some room to innovate and propose solutions. Some tender criteria also, they need to be better developed. Some what are the suitable awards criteria that I need to use with these innovative suppliers, for example. So what I'm looking actually, so am I focusing just on cost? So if so, it's not the best way, right? And finally, there are a few feedback that these suppliers get from public buyers. Let's say a supplier did not get the award of this tendering process, but this supplier, especially small and medium enterprises, they don't know why they didn't succeed. So this feedback is very valuable for the future to include these more less favored suppliers, such as SMEs, for example. So to wrap up, so to overcome these main cultural barriers, what is needed? Training and education, because public buyers, many times they need some more knowledge on the topic. And that's also one of the actions that InnoHSupport project is doing right now. We have the masterclass and train the facilitator program that you can also enroll until the 31st of August. Simplify procurement process and regulations. Sometimes they can be not as flexible, especially for smaller suppliers to enter the tendering process and can actually develop more innovation. Collaboration and knowledge sharing between public buyers. They can share, for example, best practices. That's also a good pathway to go. And finally, promote more diversity and includes inclusion in supplier selection. So again, I come back to the case of the SMEs, that they are generally less favored because they might lack expertise, for example, or scale to win these awards. So that's all, and thank you very much for your attention.
Thank you, Carolina. Very interesting to see, I would say, all these barriers mapped, and it's quite a load of work, I think, that needs to be done in order to tackle these. We come back to this a little bit later, and now I'm quite keen to hear your insights, Maria, namely on reducing cultural barriers in PPI.
Sorry, thank you very much, Elisa, for bringing me here today and giving me the opportunity to present some ideas. There is not the recipe for success, but I think we are a big group of entities and people that are working and collaborating and trying to reduce these barriers and to push forward the potential of this powerful instrument. So I'm Maria Sanchez. I'm a Senior Open Innovation and Innovative Procurement Manager at EIT Health, a central office in Germany. As you know, we operate with different hubs, and our aim is to foster innovation across Europe. And one important tool, it will be precisely in innovation procurement. So this is part of our remit and a very important subject that we want to promote and to support from our organization. And this is the task I'm doing at the moment. I'm gonna share my screen now and show you one of our initiatives. So let me share it. I'm gonna transfer that. So I hope you can see my...
Yes.
Okay, perfect. So I'm gonna show you the HIPS project. So HIPS was funded under the same call as InnoHSupport, and basically we are also trying to support the health innovation procurement by creating a platform that of support services. But let me start from the beginning. So going to the why. So why we are looking at this at this situation. We were thinking on HIPS precisely on the way that the interface in between the healthcare system and providers and the health tech companies. So what we were looking, trying to deep dive in some of these barriers is precisely this interaction. What happened with the health tech companies? It could be digital, it could be medtech, or it could be biotech. When they try to reach the market and being adopted, sometimes we find that innovations really don't cover a real unmet need. And this could be why they don't get really to market and to being adopted. So thus, healthcare providers cannot really consider these solutions. But also, the access to market and getting these first buyers is very difficult for them. How and when they connect together, how can they get to co-develop or to innovate together with the healthcare system and the healthcare provider? So this is precisely one of the main difficulties that these health tech companies find. And also, and what is more complex is scaling across Europe. So once you get into one of the market, how you can be scalable and even procure in other countries. So this is something that we were thinking a lot when thinking about this project. So, but also what we find very, very interesting is many of the barriers, no, that Carolina was mentioning, but that really makes healthcare system with an urgent need of procuring innovation and getting innovations adopted. And is the growing of the aging population, the chronicity of the population. So there is a lot of chronic diseases that really makes the system to engage with patients for a long time, and that creates a rising cost of the healthcare delivery, and also creating constraints in the expenditure and also lower resources in general, no, in healthcare, in medical doctors, but also in the provision of health. So how can really make the innovation happen is in this interface of what is the technology push and what is the market pull. So health tech companies usually they innovate and they try to put the technology on the market by doing a push, and healthcare providers what they need to do is doing the opposite. So pulling from the market what a good innovation is. So usually this is what really happens, no, that sometimes healthcare providers doesn't know what a good innovation is, or what is the best team to collaborate with, or is this innovation that I'm gonna adopt now gonna be sustainable and will be adopted fully in the healthcare system and adopted and value for all stakeholders. So in here, there is a lot of support. So how health tech companies can really advance technology and scientific research and be driven by that, it is important, but also from research up to the market, there is a big gap that they need to manage to create a product or to create a business case or a business model that really fits with the market. But also we need to understand precisely if this innovation really covers the needs and the demands. Okay, so this is the basis of the HIPS project. And also what we find very, very interesting is that there is a high level of amount of the GDP invested in public procurement to innovate. So there is the margin and there is the capacity. However, we consider is underused, and it could be very, very important tool to really co-develop innovative solutions that really save the market and increase the quality of the services. So we really need to get to the full power of this procurement of innovation. So this is basically, I'm going to go very quick because we are going to talk about PPI, but sometimes, and just to mention, it's worth engaging with the innovators in an early stage. So in order to support them in the solution design, the prototype development, and later on the testing of these prototypes. So more and more what we are telling innovators is engage with the providers, with the healthcare system, with even with the patients at the very earliest stage, and then you will make sure that what you are developing is shaped for success. Okay, and then finally the last part, it will be the really procurement of innovation, that the getting into some volume of commercial products and test them how is integrated and how can be of a replacement of the current standard of care. So basically, we see a mutual benefit of using the innovation procurement for both, for health tech companies and for healthcare providers and system, because for health tech companies, they speed up time to market, they really get a concrete business opportunity, a validated need, and also it can attract future investors, and it can be support of scaling up internationally. And also for healthcare providers and systems, it could be the only way to really leverage all the resources and making the correct use of the resources that is needed to address these societal challenges, to be able to treat and accompany patients and in the way they need it, even more from home and more delocalized in rural areas, in underserved populations, and so on and so forth, and also improving the quality and the efficiency of the public services. So, and now is the moment. So if you think about it, there has been several reports, the Draghi report, the Enrico Letta report, and then later on the European Commission communication that they really want to get an ambitious national innovation procurement policies, and they see the innovation procurement as a key tool to really support suppliers to innovate and to create solutions, but also they mentioned the need of creating more and more action plans to mainstream the innovation procurement. But there is also a very much interest in creating the single market in Europe. So after being able to share the same coin and the free circulations of goods and services, now what they want is kind of a free circulation of solution companies, and also sharing data. So a common market for innovative solutions will allow this complexity in the regulation, but also will allow the sharing of data, the sharing of market size, for example, in low rare diseases with low cases, or pediatrics, for example, is a tool that can really support the development and the market size for some of the products. And this could be attraction for developing solutions in these particular areas. And also, they are mentioning that it's going to be an strategic economic and technology priorities to drive innovation, no, by public procurement. So I think it's the right moment to set up the community and the different tools to support the use of this tool. So how we are planning on doing that? So from us, we want to create an integral support from the beginning to the end. So we separate the procurement process in different stages. So one, it will be setting the scene. And here we will be covered who we need to engage, why we need to engage them, what are the key elements that should be in place in order to consider the innovation procurement and the right tool. So if that is a PCP or a PPI, and how we want to shape it, then it will be more the proposal preparation and the funding securing. So what is that we need to do? What is the maturity level that we want to engage with the market, and who we can consider to fund this project or this activity. And then later on, obviously, being public money in place, we need to prepare a tender and engage with the market properly in order to understand if what we are looking for is feasible, is the market ready to reply to our request or not, or which are the trends of the market that we want to embark and really consider this is the wave we want to catch. And then also support in the implementation of the contracts and the interaction in between the different stakeholders. This is critical. So we will propose on methodologies and tools to support in that, and later on scaling up and how to move on precisely more in the business model or business case development. So
Maria, sorry to interrupt. We will need to focus a little bit then on the how to also ensure that we have some insights from Sophia, okay?
Yes, sure. So how we are going to do that? So in this one-stop shop is we are going to get some progress, process guidance, cultural and incentives. It will be considered financial strategies, very much focusing on legal consideration and this business model. So we are a big group of partners. So we have EIT Health as the European Innovation Network, and we are coordinating, and we will continue to include more and more stakeholders and entities that would like to collaborate with us within this platform. As you will see, we have people like Medical Valley, that is a health cluster of innovators, the developer, that they are bringing in the view of the startups and SMEs. We have Aquas as the public health agency in Spain, that they are very experienced in going to these processes. We have a legal partner, so the University of Hasselt has a lot of expertise and is doing some PhDs precisely in public procurement law, interpretation, previous cases in court, and so on and so forth. So for that, we provide this legal support and reducing the risk aversion, hopefully, to some of the companies. We also have Valde Innova, that Sophia will interact later, with a lot of experience in PPI and business model creations. And also we have market access company that works every day with startups, SMEs, and companies into supporting innovation and doing this technology push that will also bring us the other vision. So our methodology is been more iterations, lessons learned is based on previous experience and interviews. We have done a lot, then validate these assumptions and then co-ideate and co-create the support. And we have engaged with healthcare centers, regional healthcare agencies, policy makers, academia, citizens, investors, startups, SMEs. So we are quite happy. And this is the platform we are creating here. You can check the QR code, and we are creating an MVP, but we want to grow, and we want to grow the community, and each of you could be consumers and providers. So you are very welcome to be part of HIP's platform. And thank you.
Thank you, Maria, for these insights. And I think it's particularly of importance to see how to get a good balance between push and pull, and probably drive a bit more the push than the pull, particularly in the beginning. So let's see the fear of PPI and what Sophia can share with us in regards to the realities in the field. Sophia, I hand it over to you, and also please start with a short introduction about yourself.
Thank you, Elisa. Well, my name is Sofia Moreno. I'm director of Innova. This is a very small consultancy firm. We have been engaged in innovation procurement since 2016. Well, I want to share with you some few stories about this long period of experiences in the field. I had the luckiness of being procurement coordinator in Stop and Go and Ritmocore. Stop and Go was the first PPI ever launched by the European Commission, and it was a sort of experiment, because what we did there was independent procurement, and the objective was to launch a procurement of ICT-enabled services. It was a project of the SIP program starting in 2014 and lasting for 6 years. And during this period, we knocked the door of, I think, at least 40, 50 procurers in Europe. We had 12 procurers officially entering into the consortium, but at the end of the project, only 4 were able to actually procure. So it was an intensive learning experience. And I want to share with you all some of the few lessons learned in terms of cultural barriers and cultural drivers. The first story is about the procurement in Eastern Cheshire in UK. I miss a lot UK people into the innovation landscape in Europe, because these people were really able to overcome any barriers and to forget any, and they was not really risk adverse. In Eastern Cheshire, they plan to buy a service, a comprehensive service, including addressing diabetes in the society, because this was starting to be a pandemic. And then they include in the same service the education of the population, the use of monitoring devices, and the care provision. They made an impressive deployment of matchmaking exercises with all kind of different tools, and they put together in a room a lot of different people several times. I was really astonished of the exercise that these people did. But at the end of the day, it didn't work. And it didn't work for two main reasons. First, even if they try to put people together to talk, they put cat and dogs in the same room, and the ICT provider and the service provider, that basically were clinicians, were unable to talk the same language. And they didn't use enough translator between them, and they were not able to really build significant consortium. So consortia building, it could become a significant cultural barrier that I have seen later, again, in other situations. And the second point that was a significant barrier was that the procurers did not understand the business model of the care service provider. And the rules that they put were not aligned with the business model and the cultural habits that these people had. Fortunately, the failure in Eastern Cheshire was used by Liverpool municipality, which want to digitalize the care provision. So they use this previous experience and they select the ICT supplier and they offer to the care service provider the opportunity to adopt some of these ICT solutions. And they did several things very good. First, this this opportunity to start as volunteer the transition. And they did very good also the engagement of the people in the field. Carers suddenly felt, because carers are like the last in the scenario of the clinical services, clinical and social services to people. No? And then suddenly the carers found that they had a beautiful dog in their hands. And they found that very fancy, and they loved the adoption of the project immediately. The second thing that was that they engaged the families. And the third, that they show immediately to the municipality that they had some cost saving. So they did a very good change management, engaging one by one the different stakeholders involved in the service provision. So two things here: very good understanding of the business model, facilitators of the agreement between the ICT people and the care provision, and a very good and detailed engagement of the different stakeholders. The thing is that this initial innovation success became an extraordinary success in the city, because after that, they start an innovation revolution that is still lasting. Then another story that I want to highlight was in the Netherlands. The Dutch people are also very, very fond of innovation adoption. And they had a program of social innovation in the municipalities that was promoting a deep change in how the care services were offered there. Then they tried to adopt from the municipality solutions that were already demonstrated to detect early dementia. And the image that they had in their mind was very easy to understand. They had demonstrated that using some devices, they could reduce in 2 months the need of people moving to nursing homes. And the cost of a nursing home was 6,000 euros per month, and the cost of the devices was 400. So the business seems to be easy to manage. The problem was that in the Netherlands, the one responsible of buying the devices was the municipality. The one responsible of providing the care services of the nurses was the insurance. The one providing the cleaning and eating things was the care services. So there was a bunch of budgetary silos that made the business impossible. The great thing is that they, using this example, they were able to change the relationship between these entities and getting an agreement to make it work. At the end of the day, it fails. It failed also because people didn't want to accept that they had early dementia. So despite the great effort made in terms of mixing the budgetary silos, the evidence of the economical value, people is at the core of the innovation, and we need to see to have a look of their feelings also. In Italy, we have a bunch of experience, and all of them failed because one single reason. The decision makers were too far from the innovators. The decision makers in Italy at this moment, they had a strong corruption prevention system. And for this reason, decision making in terms of purchasing were concentrating in some few hands for whom this small contract, too complicated, was just a nightmare. And all of them get locked for years. And at the end of the day, they were not able to do anything with that. And the last case that I will comment very quickly, it was the one in Barcelona. That was a very successful case, starting with stop and go, transforming the way of purchasing defibrillator, and followed by Ritmocore purchasing a pacemaker. What I want to emphasize there are two things. One is that these experiences aim at changing the business model and the value chain of suppliers. And there was resistance to change from the suppliers. And that was translated in taking into court to the lead procurer. That was successfully solved for Ritmocore. So working with the industry is also very important if you want to change how they are used to work. And another thing that was important is that for nurses that are used to sit down in front of patients, to talk to them, to watch them, to move from this situation, to stay in front of a computer is a huge change. And the people was aware of that, and they didn't try to force the same nurses that were in front of the people to sit down in front of the computer. Instead of that, they found volunteer digital nurses that were excited about the experience of starting working with technology and people, and they became living part into this transformation. So take care with the people who need to change their human relationship to digital relationship, and work with the industry, explain to the industry that there will be real advantages to them. And this is the sort of old stories that I wanted to share with you all. Thank you.
Thank you very much, Sophia. And I think here we can see the challenges and also the beauty from different regional approaches. I would say cultural barriers also within the different countries, not only from different types of roles that we're seeing, obviously important within the PPI. As such. So I would like to move on a very quick round of Q&A. I will address one question to each of you, and you come up with a short answer just out of some time management. So I will start with Carolina. Looking into the barriers that you have identified, are you able to highlight the top 3? Looking into and hearing what you all have been sharing, how do we advance and how do we scale innovation? So what it is, what we need to focus on top priority in order to make that a habit and rather a barrier.
Thank you for the question, Elisa. So talking about the main barriers for PPI in the healthcare sector, I see that a big barrier is the mindset of the healthcare sector, which is very focused on cost containment. So there's very little room to think about tomorrow because, yeah, you can also see these people, they are very busy. There are a lot of demands right now for them to deal with. And the priority is to deliver healthcare for patients. So yeah, that's big barrier, I would say, in the healthcare sector. And yeah, it needs a much bigger systemic change, the way decisions are made. And for that, you need some sponsor. Yeah, of course. A second big barrier, I would say that's risk aversion. And for risk aversion, you also need to have some clinical evidence that a given innovation actually works, because yeah, these physicians, they are also heavily involved in deciding what is going to be purchased or not on the healthcare sector. And this also leads to the third biggest barrier, that's these stakeholders interaction. So you do need a big alignment between these different procurement departments and the clinical staff, for example, and also align with the higher levels of the organization. So everybody needs to be looking at the same direction and looking at what the needs are for now and for the future, and what it can do in terms of innovation. How can it link suppliers that can offer these solutions that are aiming for? So yeah, I would say those 3 are the biggest challenges we have.
Thank you, Carolina. And that is actually a nice bridge for me to share a question with Maria in the sense of systemic change. Sounds super broad and is quite complex. So how do we make that practical? And how do we, what I referenced a bit earlier, how do we help healthcare providers and systems to actually be stronger in their pull in regards to making sure that this is what they need, so we can actually then look into what innovation players are in the market to help solve that problem. What would be, from your point, Maria, the first go-to action to drive the pull within healthcare providers and systems?
Thank you, Lisa. Thank you very much for the question, because it is true that there are a lot of barriers, very diverse, very general, but we need to start now looking at in details of the things to be able to solve one part. And I think it's critical, this part and this question. So to me, what they need to do is first to consider this tool as a driver, as a pull, that at the moment for them is a task they need to do, that is procuring things for being able to provide the healthcare, but they don't see procurement as a tool for saving money or being able to deliver healthcare more efficiently, or a way to leverage resources, underused resources that they can give a second type of use. And they haven't considered this part of the innovation, the creation of a product and the business model around, as part of some of the tasks and activities they can engage with the industry. So if you think about research, there are a lot of research that is done in the hospitals or in the healthcare systems, but innovation is like, this is not for me. I don't need to engage with, I don't need to be part of that. And to me, or it is very critical and essential, but it's not a task they need to do themselves. So they don't need to be innovators. They don't have to build a company around. I think that the way to solve it and to speed up the process is by collaborating with others, like more this concept of open innovation and innovate outside your organization. Why? Because the industry has much power, speed, and push to develop something that you need. But obviously you need to be there telling them what is needed and what is precisely needed, or which business model should be in place in order to be adopted or procured, as Sophia was mentioning before. So I think they need to really start making numbers, creating a map of which resources are under use, where there is gonna be a need for more resources that maybe cannot come with more professionals or more trips to hospital, and it has to come with a solution that is innovation. So I think, and that will be, if this is the initial need, and they do the maths and the economics, and they can reduce some of the cost and then use this reduction to procure innovation, they can be the best promoters and supporters. This is
Thank you, Maria. And I mean, listening to what you're saying, that also, I would say, shouts for the transformation of the procurement function in teams. I think we need to look into broader skill sets that are actually part of the procurement team. And I would say overall also, it's a question on C-level management of making that procurement really a strategic rather than that administrative function. And I want to take that thought to you, Sophia, in regards to the different examples that you have been sharing and being in innovation procurement actually since more than 10 years. How would you be able to share an experience where you saw that C-level management was a key to enable the procurement of innovation, if you have one to share?
Elisa, I want to be sure that I understand your question. You mean when procurement is inspired from the top, not from the bottom?
Yes, exactly. From the top, that they're actually asked to deliver. If we're looking from procurement being a more administrative function, they are responding to what they're being asked. So my question would be, if you have experienced within your more than 10 years working on procurement innovation, if there is one of these national examples that you have been sharing where you had a top bottom approach by C-level enabling procurement, not pushing, but enabling procurement to actually go through the innovation process more seamlessly?
Well, honest, I will be very honest. This experience on PPI are from several years ago. When I mentioned that inside Stop and Go there was 12 procurers on board, and only 4 of them were able to procure. There was one moment when we had this top vision or this leading vision from the regional governments, from one region in Spain, from 2 regions in Spain simultaneously. It was Catalonia and Castilla-La Mancha, and 3 regions in Italy. And it happened that we had elections in all of them at the same time, and there was a change in the government. And all the initiatives were stopped by this change in the government. Other initiative that was proposed from the management in the hospital, not from the people in the field, it was more in the sense that we want to make one innovation procurement here. It was partially successful only. So it managed to run the procurement, to deploy the solution, but the impact was not as expected. In my experience, when there is not a champion or a hero in the field willing to change the world around, it has not worked. When this champion has no support from the top levels, it doesn't work either. But there are so many things to change in the all people that is around the innovation. You have to change the life of the people, the family, the nurses. There are many small stakeholders around there, and you need a lead. You need leadership to do that.
I fully agree. I fully agree with that. And I think this is also something that we, in our continuation of activity that we do in different EU projects, I think that is something that we need to take into consideration. How do we ramp up leadership on the healthcare provider and system side, but also on the procurement level, to enable and to empower? I think that is something that is very key and that has been identified. So I think it's a question on doing it and getting it on the ground, getting it also adopted from the people that we want to talk. Because Sophia, what you also mentioned, I mean, we're talking about change, we're talking about people, we want to foster collaboration. So obviously this is not a single road, but this is more a back and forth, I would say, in regards to innovation happening. And that brings me to a short wrap up in the sense of I think there is a lot that we need to do. Carolina, the barriers that you mapped, they're very heavy barriers, I think. So we are on a constant move, I would say, to tackle these from different angles and to be as practical as possible, which I believe is also a key driver. And innovation is not always set for success, which I think is the nature of innovating something and trying something out. So here we need to have that open spirit on both ends, the provider side, but also the supplier side. And therefore, we are very keen to offer all that information that is being rising from our InnoHSupport project within our Agora to help scale, to help connect, and to help everyone who wants to push for innovation procurement to have the right resources available. So stay tuned. The recording will be also available to everyone in our community, beyond our community. Connect with us, reach out to us, because as you see, there's a lot of things to be done. And as I would like to quote Sophia, we need more leaders from within and from without. So show yourself who you are as heroes and as leaders who need support in making this move ahead. Thank you, everyone, for contributing here today and for being with me and for sharing your experiences. Thank you and goodbye.